Holistic healing, embracing spirituality in nursing practice. In recent times, the field of medicine has become increasingly focused on its technological advancements, shifting away from a once thriving patient-centered model around compassionate care and service. This course recognizes the need to restore balance by embracing the holistic aspects of healthcare, specifically reconnecting with the spiritual roots that were historically intertwined with healing practices. The course highlights the positive impact of religious and spiritual beliefs, meditation, and prayer on individuals' well-being and healing process. Numerous studies have shown that those who have faith and engage in religious practices tend to experience faster and more complete recoveries. Additionally, even individuals who are prayed for, regardless of their personal involvement, have been found to heal more rapidly. Spiritual health is a crucial component in achieving overall balance between the physical, psychological, and social aspects of human life. However, the significance of spirituality often goes unnoticed by healthcare professionals, despite direct patient care accounting for a significant portion of nurses' time. In fact, direct patient care accounts for 70% of the time spent by nurses. Spirituality is an important aspect of holistic care that is frequently overlooked by healthcare staff, and nursing staff have the greatest impact on patient care. All nursing codes of ethics assume that spiritual assessment and care is part of nursing practice, and refer to spirituality as an obligation of care. Unfortunately, Western culture often struggles to comprehend spirituality and its integration into nursing practice, leading to confusion, misunderstanding, and judgments. This short course aims to bridge this gap by exploring the fundamentals of spiritual care within the context of nursing. It emphasizes how nurses can incorporate a spiritual approach into their personal practice, aligning with the core values and goals of the profession. By the end of this course, participants will have a better understanding of the importance of spiritual care in nursing, and will be equipped with practical strategies to integrate spirituality into their professional role.
Engage with chaplains, social workers, or other healthcare professionals to address.
Welcome to the course on holistic healing, embracing spirituality in nursing practice.
My name is Father Chris Bashaw. I am a Catholic priest and Franciscan friar with the Franciscans of Joy of the Gospel with the Independent Catholic Church of the Americas, and I am also a registered nurse. I am a nurse chaplain with the In His Holy Name Ministry and its Catholic Mental Health Ministry. I am also the founder of the Catholic Faith-Based Nurse Chaplain Institute. I am thrilled to have you here to embark on this journey of discovering the profound impact spirituality can have on healthcare. In recent years, it seems that the medical field has become increasingly focused on technological advancements, sometimes overshadowing the essential element of compassionate care and service. However, we at the Catholic Faith-Based Nurse Chaplain Institute recognize the need to restore this balance and reconnect with the spiritual roots that were historically intertwined with healing practices. And we want to share the importance of spiritual care associated with the role of the professional nurse. Throughout this course, we will explore the positive influence of religious and spiritual beliefs on the individual's well-being and healing process. And we will press the importance of a nurse including spirituality into individual wellness plans of care. Numerous studies have shown that those who have faith and engage in religious practices tend to experience faster and more complete recoveries. Even individuals who are prayed for, regardless of their personal involvement, have been found to heal more rapidly. Spirituality is real, and it's real important. Spiritual health is a vital component in achieving overall balance between the physical, psychological, and social aspects of human life. Surprisingly, the significance of spirituality often goes unnoticed by healthcare professionals, despite the fact that direct patient care accounts for a significant portion of nurses' time. That's where you come in. As nursing staff, you have the greatest impact on patient care. All nursing codes of ethics assume that spiritual assessment and care are part of nursing practice and refer to spirituality as an obligation of care. This course aims to empower you by exploring the fundamentals of spiritual care within the context of nursing. We understand that Western culture sometimes struggles to comprehend spirituality and its integration into nursing practice, leading to confusion, misunderstanding, and judgments. However, we are here to bridge that gap and provide you with the knowledge and tools to incorporate a spiritual approach into your personal practice. Our goal is to align with the core values and goals of the nursing profession, enhancing the care you provide to your patients. By the end of this course, you will have a better understanding of the importance of spiritual care in nursing and will be equipped with practical strategies to integrate spirituality into your professional role. We are confident that this journey will not only enhance your own well-being but also have a profound impact on the lives of your patients. Let's embark on this transformative journey together and embrace the power of spirituality in nursing practice.
What is the value of spiritual care? The value of spiritual care is immense, as it addresses the deeper aspects of our human experience. It provides a sense of meaning, purpose, and connection to something greater than ourselves. Spiritual care nurtures our inner selves, promoting emotional well-being, resilience, and a sense of inner peace. It helps individuals navigate life's challenges, find comfort in times of grief, and experience a profound sense of fulfillment and joy. Additionally, spiritual care can foster a sense of community and belonging, allowing individuals to connect with others who share similar beliefs and values. Overall, spiritual care adds depth and richness to our lives, enhancing our overall well-being and helping us lead more fulfilling and purposeful lives. Are spirituality and religion the same? Spirituality and religion are related concepts, but they are not exactly the same. Religion often refers to organized systems of beliefs, practices, rituals, and institutions that are shared by a community of followers. It typically includes specific doctrines, texts, and prescribed behaviors. On the other hand, spirituality is a broader and more personal concept. It encompasses an individual's inner search for meaning, purpose, and connection to something beyond the material world. Spirituality can be guided by religious beliefs, but it can also exist independently of any organized religion. It is a deeply personal and subjective experience, often involving self-reflection, meditation, mindfulness, and a sense of awe or wonder about the mysteries of life. While religion provides a structured framework for spirituality, spirituality can be pursued and experienced in various ways outside of religious contexts. Some people may identify as religious and spiritual, while others may identify as spiritual but not religious. Ultimately, the distinction lies in the personal and individual nature of spirituality, whereas religion often involves shared beliefs and communal practices. Keep in mind that some patients may prescribe to no organized religion and yet have personal and individual spiritual practices, and others may base their spirituality within an organized religious tradition. As nurses, if we can incorporate spiritual components that the patient identifies are important to them in their nursing care plan, and advocate and support their spiritual requests and needs to the team, after our nursing spiritual assessment, and then educate our peers, fellow nurses, to the needs of the patient, then we're doing right by the patient. But what if the patient is agnostic, atheist? Yes, believe it or not, a person who identifies as agnostic or atheist can still have a spiritual practice. And for some patients we might need to educate them on their own spiritual practices. They honestly may not understand spirituality as we are defining it. Spirituality is not limited to religious beliefs or theism. It is a personal exploration of meaning, purpose, and connection to something beyond and greater than oneself. Agnosticism is the belief that the existence of a higher power or ultimate truth is unknown or unknowable. Atheism, on the other hand, is the lack of belief in a deity or deities. Despite not subscribing to traditional religious beliefs, individuals who identify as agnostic or atheist may still engage in practices that nurture their spiritual well-being. Spirituality can involve various activities such as meditation, mindfulness, contemplation, self-reflection, connecting with nature, practicing gratitude, exploring ethical values, engaging in acts of kindness and compassion, or seeking a deeper understanding of the human experience. These practices can help individuals find meaning, inner peace, and a sense of connection to the world around them, regardless of their religious or non-religious beliefs. It's important to note that spirituality is a deeply personal and subjective experience, and it can take on different forms for different individuals. Therefore, someone who identifies as agnostic or atheist can certainly engage in and cultivate their own unique spiritual practice. The holistic approach. Nursing is built on a holistic approach to care, which recognizes that individuals are more than just their physical bodies. Our patients' well-being is influenced by various interconnected aspects, including their emotional, psychological, and spiritual health. Neglecting one aspect can hinder the overall healing process. By acknowledging and addressing the spiritual dimension, we can achieve a more comprehensive and effective approach to patient care. Enhancing patient outcomes. Studies have consistently shown that spirituality and religious beliefs have a positive impact on health outcomes. Patients who have faith and engage in religious practices tend to experience faster and more complete recoveries. Even individuals who are prayed for, regardless of their personal involvement, have been found to heal more rapidly. By acknowledging and supporting our patients' spiritual needs, we can contribute to their overall well-being and potentially improve their health outcomes. In fact, here are some clinical evidence and sources that support the inclusion of spirituality in an individual's recovery. A study conducted by Koenig, McCullough, and Larson in 2001, titled Handbook of Religion and Health, examined over 1,200 studies on the relationship between religion/spirituality and health. It found that religious and spiritual beliefs positively influence physical and mental health outcomes, including improved recovery rates, reduced mortality, and increased overall well-being. Another study by Balboni, 2007, published in the Journal of Clinical Oncology, explored the impact of spiritual care in advanced cancer patients. They found that patients who received spiritual support experienced improved quality of life, decreased anxiety and depression, and increased levels of hope and meaning. And then there was a systematic review by Pachalski in 2009, published in the Journal of Palliative Medicine, which examined 17 studies on the effectiveness of spiritual care interventions. The review revealed that spiritual care positively affected patient satisfaction, coping, and overall well-being. It also showed a reduction in psychological distress and an improvement in the spiritual well-being of patients. Sloan in 2000 conducted a study published in the Journal of Behavioral Medicine, investigating the impact of prayer on health outcomes. The study found that prayer was associated with better physical and psychological health, including faster recovery from surgery, reduced complications, and improved overall well-being. And a study by Harris in 2002 was published in the Journal of the American Medical Association, which examined the relationship between religious involvement and mortality rates. The study found that individuals who attended religious services regularly had a lower risk of death compared to those who did not. These studies, as well as others not listed here, provide empirical evidence supporting the inclusion of spirituality in an individual's recovery. They demonstrate the positive impact of spiritual care on various health outcomes, including improved recovery rates, enhanced quality of life, reduced psychological distress, and increased overall well-being. Please note that these are just a few examples, and there is an ever-growing body of research on this topic if you want to explore. I encourage you to refer to the sources mentioned and independently research additional studies within this field. Coping with illness and suffering. Healthcare professionals witness firsthand the physical and emotional toll that illness and suffering can take on individuals, their caregivers, and their friends and families. During these challenging times, spirituality can provide a source of comfort, meaning, and hope. It can offer solace to patients, allowing them to find strength and resilience in the face of adversity. As nurses, we have the opportunity to support our patients' spiritual well-being, helping them navigate through difficult moments and find peace amidst their struggles. Cultivating therapeutic relationships. Nursing is more than just administering medications or performing procedures. It's more than sitting behind a computer charting. It's about patient care. And I emphasize the word care. It's about building meaningful connections with our patients, based on support, trust, empathy, and understanding. By incorporating spiritual care into our practice, we can deepen these therapeutic relationships. Taking the time to listen, acknowledge, and respect our patients' spiritual beliefs and values establishes a sense of rapport and fosters a healing environment. Meeting ethical obligations. Nursing codes of ethics universally recognize spiritual assessment and care as part of our professional obligations. They emphasize the importance of holistic care and acknowledge spirituality as an essential aspect of human existence. Let's not forget that we are not human beings having a spiritual experience, but rather we are spiritual beings having a human experience. By neglecting spiritual health, we may unintentionally violate these ethical principles and miss opportunities to provide comprehensive care, holistic care. Embracing spiritual healthcare ensures that we uphold our ethical responsibilities as nurses. Conclusion. In conclusion, spiritual healthcare plays a vital role in nursing for several reasons. It aligns with the holistic approach to care, enhances patient outcomes, helps individuals cope with illness and suffering, cultivates therapeutic relationships, and meets our ethical obligations as healthcare professionals. By recognizing and addressing the spiritual dimension, we can provide more comprehensive, compassionate, and effective care to our patients. Let us embrace the power of spiritual healthcare and make a positive impact on the lives of those entrusted to our care. Providing spiritual care to patients, a nurse's role. Good day everyone. In this lecture we will explore an important aspect of nursing care that goes beyond the physical and emotional needs of patients. We will discuss how nurses can provide spiritual care to their patients, recognizing the significance of spirituality in promoting holistic well-being. Let's dive in. Understanding spirituality. Spirituality is a deeply personal and individualized aspect of human experience. It encompasses beliefs, values, and the search for meaning and purpose in life. It is important to remember that spirituality can take various forms, including religious beliefs, connection with nature, and/or personal philosophies. Recognizing the importance of spiritual care. Enhanced well-being. Addressing spiritual needs can contribute to overall well-being, promoting a sense of hope, comfort, and purpose in patients' lives. Coping with illness. Spiritual care can assist patients in finding solace, strength, and peace during times of illness, distress, or end-of-life situations. Holistic approach. By acknowledging and supporting patients' spiritual needs, nurses can provide comprehensive, patient-centered care that encompasses the whole person. Strategies for providing spiritual care. Establishing trust and rapport. Actively listen. Encourage patients to share their beliefs, values, and concerns, making them feel heard and understood. Non-judgmental attitude. Respect diverse spiritual perspectives and avoid imposing personal beliefs. Assessing spiritual needs. Open-ended questions. Ask patients about their spiritual beliefs, practices, and sources of strength. Observations. Pay attention to nonverbal cues, expressions, or requests that may indicate spiritual distress or needs. Collaboration and partnership. Interdisciplinary approach. Engage with chaplains, social workers, or other healthcare professionals to address complex spiritual concerns. Facilitate religious or spiritual practices. Assist in arranging visits from community spiritual leaders or providing resources such as prayer mats, religious texts, or meditation aids. Providing emotional support. Active presence. Be empathetic, compassionate, and offer comfort during difficult times. Encouraging reflection. Invite patients to explore their values, beliefs, and sources of meaning, fostering self-awareness and personal growth. Promoting self-care and resilience. Encourage self-reflection. Assist patients in finding inner strength, hope, and purpose, even in challenging circumstances. Facilitate spiritual rituals. Support patients in engaging in spiritual practices that provide comfort and peace. In conclusion, spiritual care is an integral part of nursing practice, recognizing the importance of addressing patients' spiritual needs alongside their physical and emotional well-being. By actively listening, assessing spiritual needs, collaborating with others, providing emotional support, and promoting self-care, nurses can make a meaningful difference in the lives of their patients. Remember, our friendly presence and compassionate approach can help patients find solace, hope, and meaning in their healthcare journey. When providing spiritual care to clients, nurses play a significant role in addressing the spiritual needs of patients, which can greatly contribute to their overall well-being and healing process. Here are some key aspects to consider. Assessing spiritual needs. The first step is to assess the spiritual needs of the patient. This involves open and non-judgmental communication to understand their beliefs, values, and any specific religious or spiritual practices they follow. It's important to create a safe and comfortable environment where patients feel free to express their spiritual concerns. Incorporating spiritual care into nursing care plans. Once the spiritual needs are identified, the nurse can collaborate with the patient and their healthcare team to develop care plans that integrate spiritual care. Don't forget to document in your nursing notes your patient's spiritual requests, conversations, and practices. This will support your care plan. As nurses, we know if it wasn't documented, it never happened. Document. 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 When you document, you take credit for your work. Documenting spiritual healthcare is no less important than documenting addressing change. This may include incorporating rituals, prayers, or religious ceremonies into the daily routine if desired by the patient. And if the patient wishes to pursue the incorporation of rituals, prayers, or religious ceremonies into the daily routine while under nursing care, be that hospitalization, nursing home placement, or home care, the treatment plan should also reflect this. Active listening and emotional support. One of the crucial aspects of spiritual care is active listening. Nurses should be attentive and empathetic listeners, providing emotional support and understanding to patients during difficult times. This can be done by validating their feelings, offering encouragement, and being present for them. Peer education and collaboration. Nurses can benefit from collaborating with chaplains, social workers, and other healthcare professionals who specialize in spiritual care. Peer education can help nurses gain a deeper understanding of various religious practices, cultural beliefs, and rituals to better meet the spiritual needs of diverse populations. And it can be empowering to share and educate the people you work with. If you personally feel insecure on the subject, invite your organization's chaplain or local spiritual leaders in to provide the staff with in-service and training. Respect for diversity. It's important for nurses to respect and acknowledge the diversity of beliefs and values among patients. This includes avoiding assumptions or biases based on their own spiritual or religious background. Cultural competence plays a crucial role in providing holistic care that is respectful and inclusive. Now, let's address what to do if a patient's spiritual request is foreign to you. In such cases, it's essential to approach the situation with an open mind and seek guidance. Here's what you can do. Seek consultation. Consult with a chaplain, religious leader, or another healthcare professional experienced in spiritual care. They can provide insights, guidance, and support in understanding and meeting the patient's spiritual needs. Cultural and religious resources. Utilize available resources, such as books, websites, or even community organizations, to gain knowledge about different religious and spiritual practices. This will help you provide appropriate and respectful care to patients whose beliefs may be unfamiliar to you. Foster a therapeutic relationship. Maintain open and honest communication with the patient. Express your willingness to learn and understand their beliefs better. By fostering a trusting relationship, patients will feel more comfortable sharing their spiritual needs, and you can work together to find suitable solutions. Remember, the goal of providing spiritual care is to support patients in finding meaning, comfort, and hope during their healthcare journey. By incorporating these strategies into your nursing practice, you can contribute to their overall well-being and enhance the quality of care provided.
Examples of spiritual care in nursing. As healthcare professionals, we all know that providing holistic care is essential for our patients' well-being. And when it comes to holistic care, spiritual care plays a crucial role in assisting patients to find peace, comfort, and meaning amidst their healthcare journey. So, let's explore some actual examples of spiritual care in nursing. Take your cues from the patient. Since patients are guests in our hospitals, residents in nursing homes, and we are guests when we enter their homes, it's important to let them lead in every visit. Don't try to bring up topics about spirituality, church, or religion. Instead, start by asking how they are and what brought them into the hospital. This gives them the opportunity to share what's important to them. Active listening. One of the simplest, yet most powerful examples of spiritual care is active listening. By attentively and empathetically listening to our patients' concerns, fears, and hopes, we create a safe space for them to express their spiritual needs. Also pay attention to your patients' nonverbal cues. Sometimes patients try to be nice by not speaking up when they need something. Remember that some individuals are in an uncomfortable situation that prevents them from clearly communicating how they want to be cared for. Before you can offer any sort of spiritual support, it's important to first meet your patient's physical needs, whether that means adjusting the bed, turning off the TV so they can have some quiet time, or helping them to the bathroom. Rituals and religious practices. Recognizing and respecting our patients' religious and cultural beliefs is vital. Accommodating their religious rituals, such as prayer, meditation, or sacraments, it can bring them a sense of spiritual fulfillment during their hospital stay. Their spiritual beliefs may also include dietary restrictions or rituals, which need to be incorporated into their care plan. It's okay to ask the patient how you can support them spiritually. One of the easiest ways to provide spiritual care is to simply ask patients how you can support them and then do your best to follow through on the request. For example, If your patient is a Greek Orthodox Christian and wants to see a priest before they go into surgery, call the Greek Orthodox Church in your community and ask if the priest would be willing to make a visit. Remember not to promise your patient anything that you're not sure you can deliver. Instead of guaranteeing a Greek Orthodox priest by 3 p.m., just say, "Let me look into that and see what can be arranged." If the priest is not available, offer to contact a chaplain to pray with the patient. And if you're comfortable with prayer, you can offer to pray with the patient as well. Support patients within their own faith tradition. The point of providing spiritual care is not to convert patients to your religion. It is to connect them with the divine, if they want it. Remember as you interact with your patients that they are a captive audience, often confined to a hospital bed that they don't want to be in. In these circumstances, it's always appropriate to demonstrate universal and unconditional love and compassion, but it's not fair to tell patients what they should believe. This is an area that can create internal conflict for caregivers who want to remain true to their own beliefs. The best advice that anyone can offer you is this. Try your best to help patients within their own faith tradition, but always remain true to your conscience. For example, when praying with patients who are not of your faith, make sure that the words you use do not conflict with your own, or the patient's beliefs. This brings up that sometimes caregivers are unsure how, or when to ask a patient if they'd like you to pray with them. A general rule of thumb is this: if your patient expresses they may be inclined towards prayer, and they appear to be in distress, it's okay to ask if you can pray for them. You can approach the topic by saying something like, "Mrs. Hill, would you mind if I say a short prayer with you?" The word "short" is important because it signals to the patient that even though they don't know what you're going to say, they can probably tolerate it because at least it will be short. And if they decline the offer, don't be offended. Again, the timing in their life may not be at that moment. By offering, they know you're open to prayer and you've opened the door for them to ask if they change their mind later. Also remember that at the end of the day, people don't convert people. We each must explore and find our own spirituality for ourselves. Listen to fears and concerns without going into your own stuff. When someone starts sharing their concerns with you, it's easy to say, "I know how you feel," and then launch into a story about one of your own experiences. But in truth, they don't want to hear about you, they want you to listen to them. Just be mindful that you're there to care for the patient and not the other way around. To provide emotional and spiritual support, it may be much more helpful to name the emotions you hear patients or family members expressing, and then ask follow-up open-ended questions. For example, you might respond with, "I hear a lot of anger in your words. Can you tell me where that's coming from?" Or, "You seem to be very sad. Can you share with me what's going on?" Don't be offended if they don't want to open up to you. Again, just take it as a sign that the timing isn't right. Sharing an encouraging thought or word has an amazing way of uplifting spirits and encouraging people. If you can memorize 2 or 3 short, spiritually neutral quotes, so that when the opportunity arises, you can pull from that well of growing spiritual wisdom that you have accumulated. You in turn can provide some spiritual encouragement. Don't forget about the gifts of presence and touch. For some, the concept of being present may be challenging. Ever been with a person who lost a loved one or whose loved one wasn't doing well? How often did you want to say something to comfort them? Sometimes people don't want words, they just want to know that someone is there who cares. Your presence alone can provide this care to an individual who is hurting. You are simply representing the divine in that moment by just being there. Touch is another thing that can help provide reassurance. But don't just do it without knowing their history. People with trauma histories may have an aversion to touch. It's always wise to ask first. Is it okay if I hold your hand? Or, is it okay if I give you a hug? Creating sacred spaces. Provide a designated area within the healthcare setting as a quiet, peaceful, and contemplative space can offer patients a sanctuary for reflection, prayer, or meditation. Facilitating chaplain services. Collaborating with hospital chaplains or spiritual counselors can ensure that patients have access to appropriate religious or spiritual guidance whenever needed. Supporting grief and loss. Assisting patients and their families through the grieving process by providing emotional support, facilitating memorial services, or connecting them with bereavement resources can be an important aspect of spiritual care. Life review and meaning-making. Encouraging patients to reflect on their life experiences, values, and accomplishments can help them find purpose and meaning, especially during challenging times. Supporting end-of-life care. Recognizing the spiritual needs of patients nearing the end of their lives is crucial. Offering emotional support, facilitating discussions about life after death, and connecting patients with their preferred spiritual leaders can bring comfort and solace. Ethical decision-making. Engaging in ethical discussions and supporting patients in making morally conscious decisions that align with their spiritual beliefs is an essential part of spiritual care. Providing resources and literature. Offering patients access to spiritual literature, sacred texts, or other resources that align with their beliefs can provide guidance and support in their spiritual journey. Collaborating with interdisciplinary team. Working collaboratively with chaplains, social workers, psychologists, and other healthcare professionals ensures comprehensive spiritual care that addresses patients' diverse needs. Remember, each patient's spiritual care needs are unique, so tailoring our approach to meet their individual beliefs and preferences is vital. By incorporating these examples of spiritual care into our nursing practice, we can provide a compassionate, holistic, and patient-centered approach that promotes healing and well-being.
In conclusion, I hope that this course, Holistic Healing, Embracing Spirituality in Nursing Practice, has provided you with valuable insights into the significance of spiritual care in our nursing practice. We have explored various examples of how we can integrate spirituality into our patient care, ultimately fostering healing and well-being. By recognizing and respecting our patients' spiritual beliefs, actively listening to their concerns, and creating sacred spaces, we can establish a nurturing environment that addresses their holistic needs. Supporting their religious rituals, facilitating chaplain services, and assisting with end-of-life care are additional ways we can offer spiritual comfort and guidance. Moreover, as healthcare professionals, we play a vital role in helping patients find meaning and purpose in their healthcare journey. Our willingness to engage in ethical discussions, provide resources and literature, and collaborate with the interdisciplinary team ensures that we deliver comprehensive care that embraces spirituality as a fundamental aspect of healing. Remember, each patient is unique, and their spiritual care needs may vary. It is our responsibility to approach each individual with an open mind, respect, and empathy. By doing so, we create a safe and inclusive space where patients can freely express their spiritual concerns and seek solace. As you move forward in your nursing practice, I encourage you to integrate these principles of holistic healing and spirituality into your care. By doing so, you will not only enhance the patient experience but also find fulfillment in your role as a compassionate and empathetic healthcare provider. Thank you for your dedication to providing holistic care, and I wish you success in your journey towards embracing spirituality in nursing practice. Together, we can make a tremendous difference in the lives of our patients. And who knows, maybe you'll want to be a faith-based nurse, a parish nurse, or nurse chaplain.